Hi, everyone. Hope you're enjoying the conference so far. Thanks so much for taking a few minutes to see my poster today. My name is Victoria Sagal. I'm the lead of patient involvement for the Canadian Medical Association Journal, or CMIJ. And on behalf of my co-authors, Meredith Weinhold, Kirsten Patrick, and Andreas Lapakis, I'm really pleased to be able to speak with you a little bit about our work. So this study, using custom questions to assess patient involvement in articles submitted to a general medical journal, was conducted to help CMIJ understand how submitting authors were answering two questions that we added to our submission platform. These two questions prompt submitting authors to indicate whether patients were involved in any capacity in their work as patient partners, contributors, etc. And the second goal of this study was to understand the ultimate publication success of submissions to CMIJ that involved patients to help us identify if there's any barriers or things that we need to address internally. So for those who aren't as familiar with CMIJ, it is a general medical journal that publishes original research, ongoing clinical education for doctors, analyses and commentaries about aspects related to health, news, podcasts, blogs, and other social media products, all of which are centered around clinical care and healthcare. And in 2021, CMAJ announced that our focus going forward would be to increase the number of patient perspectives included in the journal at all levels, from governance to their inclusion in our content. And if you'd like to learn more about our patient engagement strategy, I'd encourage you to scan the QR code if you have your phone handy, which will take you straight to our statement of purpose on the website. And for anyone who's not familiar with patient engagement, every time that I say patient, I'm referring not only to patients themselves, but also to their family members, informal caregivers, and friends. And patient involvement is a broad term referring to a number of different activities falling under the meaningful and active collaboration of patients with researchers and clinicians on different projects. So with time, as patient engagement has become more common, people have been interested in synthesizing data generated by patient partner teams and have found it difficult to do so for a number of reasons, including differing terminology, both for the type of work and also for what patient partners are called. Because patient authors may or may not be recognized as, patient contributors may or may not be recognized as authors on published products. So internally, we were interested in finding a way to capture all submissions sent to CMAJ, regardless of the terminology used by the teams themselves, so that we could track A, what we were receiving, and B, how successful articles with patient involvement were going through the process. So in March of 2021, we added these two questions to our online submission platform. The first one, does your submission of patient co-authors or acknowledge the contributions of patient, family, or caregiver partners, is mandatory for all submissions sent to CMIJ. And the second, was any part of your research study design or conduct informed with patients directly, e.g. through patient involvement on your team, is mandatory only for research articles. So in this study, we wanted to look specifically at how submitting authors answered the two questions presented on my previous slide, and to use this information to have an initial idea of the ultimate publication success of submissions to CMAJ that involved patients. So we looked at all articles in which submitting authors clicked yes to one of these two questions that were sent to CMAJ between March 2nd, 2021 and March 1st of this year. And we deduplicated the list by DOI so that the most final version of an article was included, for example, in cases where a revision was needed to be submitted. And to confirm whether a submission truly had patient involvement, we looked at all of the information provided by the submitting author, such as the cover letter, open text field, questions, Script2 short form questionnaire, editor notes, manuscript files, etc. If we could confirm that yes, we see that patient involvement was described in one of these ways, it was deemed a true positive. And if it could not be confirmed, an article was deemed to be a false positive. So of all of these submissions sent to us over this period of time, we had 192 for our final sample once we removed duplicates of articles that had clicked yes to one of these two questions. And when we look to confirm whether patients were truly involved in the methods described previously, we're able to find 67 articles that, yes, we could see that the submitting authors had described patient involvement in some way, and yes, they clicked yes to the question. So that means ultimately we had 67 true positives, 19 of which were ultimately published. And when we compared this list of 19 published articles with a list maintained separately to this study, in which we look at all articles published in CMAJ, we were able to see that, unfortunately, there was not a perfect match between these two lists. There was an additional 14 articles in the published sample, for which the submitting author had clicked no to the 2 questions of interest. So essentially, we had 14 false negatives. And when we look specifically at the 67 true positives described in this sample, 63 of them were submitted by an author that had an affiliation that was based in Canada, suggesting that perhaps familiarity with this terminology may be how they were able to answer these questions successfully. Among all of the articles sent to us, there were 80 research articles in which the submitting author clicked yes to one of these 2 questions, 33 of which ultimately had patient involvement, so about 41%. And 11 of the published articles that were true positives had one author who was a patient. So overall, our take home from these results is that 34.5% of articles answered these questions correctly, true positive, but that there were a number for which we missed by using these questions. And ultimately, this is because many authors answer these questions incorrectly. There may be a number of reasons for this, including lack of familiarity with patient engagement terminology, unclear wording, and not reading the questions carefully, or not identifying themselves as patients in the case of healthcare professionals sharing a personal experience they'd had dealing with their own health, but may not have recognized that when they're answering the questions. We're not quite sure, but this is something that we'll be looking forward in the future. The goal of these questions is to really see if it would make it easier, more convenient for the editorial team to track patient involvement with time. And so we do believe that this is important, and we'll be continue working in the future to see if there's ways we can improve the results of this, or if there are other detection methods that we can use. So unfortunately, I'm out of time today, but if you have any questions, please contact me at the email provided below, and I'd be happy to answer them. Thank you very much.